Coffee benefits that professionals have shown. Connoisseurs of coffee, rejoice! Your favorite beverage has a lot of advantages. Like the 7 characteristics that these researchers have shown. The Council for Poison Education and Research, America, said early last year that coffee could cause cancer due to the presence of acrylamide, shocking the entire world. In 1991, the WHO briefly included coffee on its list of carcinogens. Currently, a great deal of study has been done on coffee. The findings surprised everyone. It turns out coffee offers a lot of advantages. According to Prevention, 28/9, there are several benefits to coffee that have been demonstrated by studies. 1. To stop diabetes. Coffee consumption, according to Harvard University researchers, may help reduce the onset of type 2 diabetes. According to a study that was presented in the journal Diabetes Care, the more coffee you consume, the less probable it is that you will develop type 2 diabetes. However, doctors recommend limiting daily coffee consumption to no more than 8 ounces. Coffee includes chromium, a mineral that aids in the body's utilization of insulin, which serves as proof of this. A hormone that controls blood sugar is insulin. 2. Decrease cancer risk. A recent study by the U.S. health research organization BMJ found that coffee has more than 1,000 chemicals that have anti-inflammatory and anti-cancer properties. According to Susan O., director of the Johns Hopkins Nutritional Research Program, who was not involved in the BMJ study, the coffee bean itself contains antioxidants that prevent damage from free radicals that can potentially cause cancer. Additionally, studies have shown a strong correlation between coffee drinking and a lower risk of melanoma, leukemia, prostate, and endometrial cancer. In fact, a 2017 study from the University of Southern California indicated that coffee consumers were 26% less likely than non-drinkers to acquire colorectal cancer. (3) Decrease Parkinson's disease risk. Tremors are a symptom of Parkinson's disease, which affects the central nervous system. Researchers are still looking for the disease's origins. But a number of recent research have revealed that caffeine protects against this illness. Researchers came to the conclusion that those who consume coffee in moderation have a lower risk of Parkinson's disease in a 2017 analysis of the literature that was published in the Archives of Medical Science. Sadly, they were unable to determine the cause. 4. Decrease Alzheimer's risk. Researchers have discovered a connection between drinking coffee and a decreased incidence of dementia during the past 10 years. The performance of the brain was closely correlated with caffeine content. Participants in a short research who consumed little coffee exhibited evidence of memory issues. You thereby run the chance of getting dementia. The study lasted between 2 or 4 years. 5. Safeguards the heart. For many years, caffeine had to be avoided by those with irregular cardiac rhythms who were at danger for sudden heart failure and stroke. A fresh meta-analysis that was released in April 2018 presumably disproved that taboo. According to the study, consuming coffee can actually cut atrial fibrillation frequency by up to 13%. Additionally, according to the BMJ, coffee drinkers have a 19% lower chance of dying from cardiovascular disease, and are 30% more likely than non-coffee drinkers to pass away with a lesser stroke. 6. Prolong life. For lovers coffee, this is welcome news. Because they have many ailments, coffee connoisseurs, according to the study, have a lower mortality rate. The explanation is that studies published in the European Journal of Epidemiology in 2016 showed a strong correlation between 4 cups of coffee per day with a low risk of death. Deaths from cancer and heart disease are included in this. 7. More energy when exercising. Coffee can be the appropriate decision, because the cause was discovered in a 2013 PLOS One research. In that study, athletes who drank coffee an hour prior to training performed better than those who did not. A 2015 study published in the International Journal of Sport Nutrition and Exercise Metabolism also shown that individuals who drink coffee prior to exercise burn more calories after exercise. EPOC is the name for this, excess post-exercise oxygen consumption. This demonstrates that the body continues to burn calories even after exercise.